You're live.
Good. You can't feel it much? Good. Hey guys, it's Dr. Emer. We're now doing Halo. I'm still waiting for Beyonce to come in and do the treatment. This is the only hybrid fusion laser in the United States, and what it does is it uses two different wavelengths to laser the skin. So you can see the little dots right here. Those are the erbium wavelengths. Those are going to create little holes, which I'll show you in a second. Will lightly speckle and exfoliate, improving her ice pick scars and texture and pores. And then the redness, the red that she's going to get is a deeper 1470. That's going to give us a long-term collagen. That's why you really can't assess this treatment for at least 6 to 12 weeks, because it really does cause tissue remodeling that we see later. Right now, you're going to see the erbium, which is all these dots, but later the long-term improvement is going to be from the 1470. This could be used for photo rejuvenation, pores, anti-aging, sun damage. We're using it here for scarring and just overall anti-aging. We've already done PCA across for some of the ice pick scars, which always look a little worse at first, and then over the next few months improve. She's doing great. There's some shakiness from the numbing, but is the pain out of the 10, what would you say? 1. Perfect. Good. That's why I do this, you guys. I know it's a little more time consuming, and it's a little like the heart rate goes up and a little nerve-wracking for the patient, but in like a few hours she'll have no pain. And the first couple hours after laser is the most painful because it causes swelling. It's like a sunburn. So we do red light, we do Emerald's cosmetic ablative laser package, we do my skincare line, Emerald Skin, all of that to calm the skin down. PRP and light therapy to make her heal faster, and then she can use cooling masks, red light, and ibuprofen later, even Claritin if you want. You guys can see, take a look up close, all the dots. She's doing great, I'm very happy.
This is a skin resurfacing laser.
What is it for? Well, tell them, because I have a thick mask on. It's too hard.
She's working right now on her acne correction. She's gonna fix her complexion, guys, with the hybrid fractional laser.
And you guys gotta be really careful with this laser. If you don't know what you're doing, it can really harm people. A lot of people misuse this laser. She's very light skin tone and light eyes, so we can go strong like this. But this really isn't the best laser for a melasma or a pigmentation. It can worsen it.
Is this safe for all skin types?
It is, but not really. You really have to be individually assessed to make sure, because it can cause hyperpigmentation if not done proper. These dots are ablative. They're not, and they're a combination of both ablative and non-ablative, meaning risk of pigmentation. But I love, you guys will see all these little dots. These dots are going to become little holes that are going to exfoliate and improve her complexion. Nice and slow. Very even and meticulous. Very important. And this is her Labor Day, guys. This is her vacation right now. I just did a peel. I just did my Aerify with a bunch of cotton Milan 2 actually. So I'm red and burning right now, too. We're almost there on this side. You're doing great.
Should I do my Aerify kit before this or after?
Well, if you do it before, it'll prevent hyperpigmentation and it'll improve the result. If you do it after, it'll treat any discoloration. So how about both? Go to emercosmetics.com and I would start this a week or two before and then 3 weeks after. We also have the ablative laser package. That is my suggestion, but a key ingredient after laser are growth factors and peptides, so my refit ACNE, but also hyaluronic acid, HYLA-B.
Is this a CO2 laser?
No, guys, tell them what it is. Well,
No,
I just told
it's a
them.
hybrid fractional laser.
What's the what is that laser? That's erbium, not
Yes.
CO2. Okay, turn all the way now to the right. And you guys can see here now, all this here is the subcision. You did a great job on that. So what else are they asking?
They want to know when you should start getting your lasers.
I mean, you guys know what I say. At least mild peels and mild lasers in your 20s, stronger lasers in your upper 20s to 30s every quarter, like the Halo, for prevention. Start your enlightened Cosmolon and Aerify peels now, no matter what age, even if you have this acne.
For those that just tuned in on TikTok, what is it that you're doing?
Halo, guys, this is for acne scars. This is to improve for complexion and also get rid of blemishes and scarring and irregular texture.
Why are there dots forming? What's happening?
This is laser energy that's burning the surface, and it's going to cause her to peel and improve the overall look of her skin.
And this is a good treatment for who? What type of patient?
So really any skin type, but the lighter the better, and any of those that want rejuvenation, who want to improve scars, get rid of discoloration and sun damage. But I'm focused right now on her scars.
Does it hurt?
How do you feel? Doesn't hurt. She can barely speak, just so you know. But she has all the nerve blocks. Tell them more, you guys. It's hard for me to talk through here.
You got it. So if you guys see like those dots right there, the dots that you guys see, that's the laser. What's gonna happen is it's gonna peel and it's gonna create collagen, which is what makes the skin smooth. If you have acne scars, if you have maybe like imperfections in your skin, this helps with the complexion of the skin. Now this laser we call it a hybrid, so it goes over and under, right?
Exactly. So the dots are the erbium on the surface, which is a different wavelength than the red, which is the deeper 1470 nanometer. That's the non-ablative laser that goes under the surface for long term.
Now Menace77 said, nice, I love to have perfect skin. Tell us how do you get perfect skin with lasers or skincare treatments?
Well, that's where I want you to come and consult with us so we can individualize. Go to emercosmetics.com, sign up for a virtual consultation, and we'll decide what's best for you. She's going to peel before this, and then she's going to do skincare after, and all of that is on our website, and we can plan it for you.
Now this laser here, you guys see those little tubes? Those tubes have air that cools the skin. Now why is that important, Dr. Emer?
Because we don't want to burn the skin, and keeping the skin cool also prevents hyperpigmentation or burn. There's also another tube in here that suctions the skin up. Look at here, that's all dead skin right here. All the skin cells that have been dying. That we're killing and we're breaking up because we want to improve her scars. Alright?
So again, for those that just tuned in, so this laser is going to help even out the skin. Now if you have acne scars, which some of us had them either in high school or in college, your skin's not perfect. This is going to help, but you don't just do one laser, you do a combination treatment. And it has to be tailored. Not all skins are the same.
Exactly. So for her, we can go a little stronger. That's why you guys are going to see some bleeding.
Yeah, so that bleeding is because it's a strong laser, but She has nerve blocks and numbing cream. She does not feel
Much pain at all.
And of course, we have to protect her with the eye shield.
Did she have fat transfer to her cheeks and jaw? No, she had Sculptra injections before.
And there's nerve loss. So that's it, you guys. I'm going to continue with the halo, and then we'll come back live again when we do the fractional laser for just her bad scars on her cheeks. Bye.
Minute 77 said that this